If you're a physical therapist or you're just someone who's interested in human performance, this is the book I would recommend in terms of trying to figure out your body mechanics and if you're having any kind of problematic issues with recurring pain and stuff like that. Especially if you're a new physical therapist, I think it's good to have this kind of a book. This session is just going to be about general posture, something you can do anytime, right? So if you're sitting a lot for work, like a lot of folks are, you're at a desk, you're at a computer, and the tendency after a period of time is going to be to slump into a little bit of flexion in the spine, to have rounded shoulders, a chest that's depressed, and of course, the classic forward head. Most of the time, what people will do to try to correct this is sit up straight. Right? So this strategy of sitting up straight is actually problematic because what I'm doing is I'm using the musculature of my back, my paraspinal muscles. Right? Those muscles basically are contracting, getting nice and tense, as are the muscles in my abdominals and my chest. And over time, I'm just going to collapse, right? Probably within 30 seconds to a minute, because these muscles aren't designed to hold yourself upright like that. Right? So you'll collapse, and unconsciously you'll be right back to the work that you were doing. And then you'll start to get achy in the back somewhere, and then you'll try to create a shift. Right? So this strategy doesn't work. Something similar happens when we're standing as well, and I'll get to that in just a moment. But the main thing you want to address when you're sitting is the position of your pelvis. So whether you're sitting in the back of the chair, or you're sitting towards the front, or your legs are crossed, right? Whatever you're doing, you want to get yourself positioned so you're a little more forward on the pelvis, right? So we would call this in physical therapy, we would say you're doing an anterior tilt of the pelvis. And what this does is it gets you a little more over your pelvic floor. Once you're there, you'll feel that you have a little more weight in your legs. Whereas if you're like this, your legs start to lift because your psoas, your hip flexor muscles are starting to lift and your lower abdominals are tense. So you come forward and you're relaxed. Right. So in this position, or this position where I really get my pelvis back into the chair, I'm able to use the structure of my skeleton, right, for posture. Right. So shoulders should be relaxed. And if you're doing a lot of work and you're finding that your shoulders are getting sore or tired, or your neck is getting fatigued, you want to see if you can get your arms supported on the armrest. And if those aren't working, you could get one of those foam rollers or a couple pillows and just rest your arm, your forearm and your elbow on top of a pillow, and you'll find that will really greatly reduce the tension and the stress in the arm musculature. All right, so that's your basic sitting. All right, so coming out of the chair, I want to see if I can be smooth instead of jerk myself up. So I'm just gonna come forward and I get my weight over my base, and then I just unfold, right? Instead of pushing into the ground, which creates more tension. So my body feels relaxed. Right, so after we stand for a while, what will oftentimes happen is we'll start to lean into ourselves, right? This would be like a sway back position where the hips are starting to go forward and I'm hyperextending in my knees. The weight is shifting into the front of my feet, right? Because I'm doing this with my legs and my hips, I start to counter that somehow with my pelvis. And in my case, I would, more likely have this depressed sternum again, right? My chest is a little lower, rounded shoulders, forward head, right? So obviously that's no good, right? So what's the usual response to this kind of a pattern? Stand up straight, suck it in. Some people try to do that, stick the chest up, right? So, but what do you feel if that's what you do, right? The primary thing that you feel as you stand up straight is more tension in the back and your core muscles, right? And again, 30 seconds, 60 seconds, 2 minutes later, you're right back to where you started, right? Because you're not using your skeleton. What you're doing with this pattern is using muscles, right? Muscles that aren't meant to be used for this sort of posture. So what I tell my clients is think of instead positioning your pelvis under your head, right? So if you were like this, you move your pelvis back a little bit until you feel like you're a little more balanced, right? You'll feel like you're more centered over your feet when you achieve that. Some folks, some of my patients who are older may be leaning forward a little more, sometimes really excessively. It can be very difficult for them to stand up straight. So give them, use a pelvic strategy where you move your pelvis. Or you can think of it as your hips. You bring your hips under your shoulders. Right, so that's a good first place to start, with trying to establish better support where you're using the ground to accomplish that. I hope this mic is working because right now there's a bunch of leaf blowers outside in the garden of the building. So what I'm going to do now is an exercise from that book that I showed you, Shirley Sarman, right? And this is an exercise to counter the tendency many of us have to round in the upper back. So what I'm doing is I'm going up the wall on the heels of my hands, so the outside of my pinky finger is touching. My thumbs are pointed backwards. And I feel movement in my shoulders and my shoulder blades. And then I'm going to focus my attention between my shoulder blades, right? Maybe the lower part of that region. And I start to activate those muscles by pulling them together. And I use those muscles to bring my arms off of the wall, right? So the middle and lower trapezius are the muscles that we're really thinking about here. All right, so then I come back and I repeat it. All right, so I'll do this 5 or 6 times, typically is what I'll ask a patient to do. All right, and then you take a rest and you feel the difference, right? 9 times out of 10, what you're gonna feel is that now your chest is a little lifted, right? Because these muscles are postural muscles and you've just activated them through the nervous system, right? So they're a little more revved up. The important thing here is so you're taking a little time to feel the difference, right? So it gives your brain a chance to start to process what might be possible, and over time you could hopefully start to repattern yourself. Right, so if I go back to this exercise, I could also think of it instead of a muscle pattern where I'm using my trapezius, I can start to focus on my chest, right? So what I do is I feel my chest starts to float forward and slightly up, right? So the movement of my chest forward and up brings my shoulder blades down and back, right? So if you just did it from here, if you just basically move your chest very gently, we're not thrusting, right? Just start to move your chest forward and you feel shoulder blades go back, right? So if chest moves forward, shoulder blades glide on the rib cage, they glide together. If the sternum is right, your breastbone, if it's going up a little bit, you start to feel the shoulder blades glide down, right? So as you make this movement, you can picture and feel that your shoulder blades are doing this. Right? What I want to see is, can I do this without a lot of muscular effort? Right? So when a muscle is contracting, the muscle fibers have these little filaments that are grabbing onto each other. So it's like if you flex your bicep with resistance, you have a lot of this happening within the muscle. But if you passively lift the hand to bend the elbow, the muscle's also shortening, right? But instead of actively contracting those muscle filaments, what you're doing is you're sliding the filaments, right? Or at least have that image, right? So that you can reduce the tendency to create unnecessary muscular tension, right? So I'm going to use this image along with my skeleton in order to make this exercise into something that's a little more integrated, right? So as I come up, I'm feeling the movement of my shoulder blades and my sternum. And then I start to feel that those muscles begin to glide when they shorten as my chest moves forward. Right? So I'm not going to go 100% in this case to try to really get those muscles to contract, because here I'm doing something different. Right? So in the physical therapy clinic, we would call this neuromuscular re-education. Right? So I'm obviously putting a little more of a Feldenkrais spin on this physical therapy exercise, right? A little more internal. Good. Again, just feel the difference. You don't have to do a million of these to feel a difference. 2 or 3, if you do them well, can create a shift. Right. So the last thing I might do is then start to apply a Tai Chi principle. Right. So I talked about movement comes from the center, right, as one of the Tai Chi principles. But in this case, it's nice to feel that principle. The Qi comes up through the legs, through the spine, and it's manifested through the hands, right? So I start with my awareness on the ground, and then gradually I pull the energy up, or I move my attention up, however you want to look at it. I move it up, it comes through my waist. I feel it coming up through my spine. And then when my energy is, or my attention is there between my spine, I start to split it into my hands. Right? And at this point, as I'm pulling back, I feel like my fingers and my hands are connected to my toes and my feet. Right? So it's a whole body exercise. That's the key difference here, right? So it's the legs, pelvis, torso, arms, hands. right? So it's important to also check in with your head, right? So be sure that your neck doesn't go into one of these types of things, where you're doing an exercise and sometimes there's a tendency to pull the chin back and flatten it, which would contract all these cervical flexors. So as I come up, I need to be able to differentiate my head from what I'm doing. Right? I should also be able to breathe, right? So I could be up here and I can get some breath into my belly. Right? So this is a good, simple exercise that you can do. Take breaks. If you have an issue, got back issues, you got shoulder issues, posture issues, do it 5 or 6 times during the day. Take a moment, especially when you've been sitting for a while, falling into that flexed, rounded position, because you need to get stronger and you need to improve the muscle tone, right, to keep you upright. But you also need to learn to be more intelligent, right, so that you use your skeleton. Practice